Minar was born to her parents in Iraq after quite good number of years. I think she is the only child they have. And when the child was born, I think they noticed that she had little amount of blueness, with which I think she was taken to a doctor there and they made a diagnosis of transposition of great arteries. She came to India for the surgical treatment. It was diagnosed to be a very complex blue baby problem, where child had the major arteries which are supposed to take good and the bad blood switched, and also there were multiple large holes inside the heart. This is a really complex situation to treat this child. I think initially they thought, even though there were 2 pumping chambers, it was practically difficult to use both. So they thought probably we should make it as a single ventricle and treat it that line. Initial surgery was a palliative surgery, what is known as Glenn shunt, wherein the blood flow to the lungs is restricted by putting a band, and we divert the bad blood from the head neck portion directly to go to the lungs, with which child will be better off when it comes to the blueness. But the problem here is the 2 ventricles which are there are not utilized. Now with that she went back to her country. She was doing fine all these 5-6 years. Now again last couple of months she has started noticing that she is becoming more blue when she plays. She gets tired excessively and she couldn't play in the school. Now again I think they came back to India. She was reassessed. She was found to have developed some new problems, like one of the valve was leaking completely. Now this again complicates the whole issue. What should be done next? The path on which she was, like single ventricle repair. Now we cannot proceed to the next stage wherein we divert entire blood of the lower segment to the heart, to the lungs directly, because the valve is leaking completely. And even if we repair this valve and do this procedure, that's not going to help the child, because these kinds of valves, once they start leaking, they're not going to do well. It is not the valve which is at the problem. It is the pumping chamber which fails over a period of time, which was happening with her. Now what are the options we have here? Somehow we should figure out a way of using both the chambers so that she can be brought back to normal as much as possible. Now with that intention, we kept the child in the angiogram. Again, it did not give us too much of information, except that the lung pressures were just at the borderline to do a single ventricle repair. We explained the relatives, the risk involved in both the surgeries, short term as well as the long term. Obviously, if we use both the ventricles, that is the best that is possible for the baby. Relatives consented and they left the decision on us to do whatever that is best possible for the child. So we took up the child for surgery, re-entry, re-surgery, and once we had a look inside, we could see 4 or 5 very large holes between the pumping chambers. Practically it was looking like one chamber. We thought we will go ahead to use both the chambers. We closed these 3 or 4 holes one by one using Dacron patches. Then we committed a large VST to the aorta, which is the main tube of the body. Whatever previously it was done, like Glenn and all that, had to be completely undone. The top chambers, the wall between the top chambers, which was excised so that blood can mix easily in the first surgery, was again undone and it was brought back to normal. Overall, it was an extensive procedure which took almost 6 hours on the heart-lung machine, with almost 4 hours of stopping the heart and the circulation to the lungs. In the end, I think she had a little bit of difficult course in the first day. I think thanks to our post-operative team, which took care of all that, and within 6 to 7 days, child was off the ventilator on her own. Now she's doing very well. She's almost back to normal. We have done 2 or 3 times repeat echoes, which shows very good function of both the ventricles. I'm sure this child can definitely go back and play in the school. And all this was possible because of 2 things. One is the expertise which we have gained over years in dealing with more and more complex problems, more and more redo situations. And number 2, I think goes to the entire team, because these are surgeries when we perform, it is not just about the surgery, it's just not about the equipment. I think it's the entire team which gives us this kind of result. The last but not least is the faith which they have kept in us.
والله منار حقيقة جت للدنيا سنة 2001. من جت للدنيا 2001 ورا شهرين 3 أشهر تمرضت مرض بصدرها، انفلونزا أو التهاب قصبات. وديتها للمستشفى، فنيموها بالمستشفى حوالي 5 أيام. أثناء الفحوصات اللي سووها هناك ببغداد، دكتورة مشرفة عليها قالت لي بنتك فحصتها عندها فتحة بالقلب، فما تبين هسه الفتحة، يصير عمرها 6 أشهر تاخذ لها ايكو وتجيب لي اياه. طيبوها وديتها البيت، ورا 6 أشهر وديتها الدكتور ثاني، هم فحصها قالوا خذي ايكو، اخذت ايكو رجعت لها للدكتورة، طلع عندها فتحة بالقلب. قالوا لي هاي احتمال اثناء الكبر، من تكبر يصير عمرها 6 سنوات 7 سنوات 8 سنوات تنسد الفتحة، وإذا ما انسدت تحتاج عملية. فهالفترة هاي راجعت دكتور أخصائي قلبية ببغداد، قال لي بنتك بيها تشوهات بالقلب صاير من ولدت، من ضمنها فتحة بالقلب صاير عندها وعندها انعكاسات بالشرايين، فلازم تسوي له عملية، والعملية ما تنجح بالعراق حاليا إلا تسفرها خارج العراق. جت منظمات دولية للعراق، وإحنا مقدمين طلب إلى وزارة الصحة العراقية، فالمنظمة الدولية دزونا للهند سنة 2005 يسووا له عملية جراحية في بنغلور مستشفى مانيبال. فجوي ويا امها والاطفال ال6 عرضوهم على الاطباء من ضمن الدكتور ديفاندا الجراح الموجود هنايا، فسوى عمليه لبنتي بال 2005، عمليه فتح صدرها، عمليه توصل الى ربط ناسور رئوي، لان الصمام الرئوي مالته مسدود. قال ما اقدر اكمل هسه الا تكبر، يصير عمرها 11 سنه 12 سنه تجيبوها عم اسوي العمليه التكميليه. فهسه احنا بال 2013 بمساعده وزاره الصحه العراقيه اللي دعمتنا ماديا ومعنويا، الحكومه العراقيه مشكوره اللي دعمتني وعطتني فلوس، وجيت الى بنغلور مستشفى مانيبال، جيت الى دكتور ديفاندا اللي اجرى العمليه وبفضله نجح العمليه مال بنتي ورجع قلبها اعتيادي سليم، كل شيء ماضي طبيعي حاليا. واحنا نشكر الدكتور ديفاندا شكر جزيل. بعد ما رجع
كانت الفتره هذه؟
الفتره اللي كانت من رجعت سوت عمليه ب 2005 ورجعت الى العراق، كانت هم تعاني، تروح للمدرسه تتعب، تزرق ايديها اثناء بالمدرسه، رياضه تتعب، صعدت الدراج تتعب، فكانت وطبيعه جسمها، لان هم خبرونا بال 2005 قال اعتبروا بنتكم حاليا على ما تسوي التكميليه اعتبروها نص طفله مو طفله كامله، لان الدم ما يوصل لجميع اجزاء جسمها 50% يوصل. هسه بالعمليه الثانيه اللي اجراها دكتور ديفاندا خلى الدم يوصل لجميع اجزاء جسمها 100%، والعمليه ناجحه الحمد لله والشكر.
Now the child is recovering. She might require probably another week or 2 before I think she goes back to her country. Especially I think she needs a bit of physiotherapy because she's been weak these many years, and now last 2 to 3 weeks of massive long hour surgery. I think she'll require another 1 or 2 weeks of good amount of physiotherapy, good eating. I think we will reassess the baby after that, and probably then she can go back to her country. These kinds of problems, yes, once we tackle them, the complex ones, do require long-term follow-up, even though periodic, because the homograph which we use in them to establish this continuity from heart to the blood vessels might not grow with her, might calcify, there is a possibility that we may have to redo that 10 years down the line, or 15 years down the line, or 20 years down the line. I think this is what we are going to tell them also, and probably if they can get a good follow-up once in a year or two, that would be the best.